This portion of New Day Northwest is sponsored by TLC Laser Eye Center.
Hi there. It's been almost 25 years since laser eye surgery was first approved, and lots of people got to say goodbye to their eyeglasses. Further advances in technology have made the procedure even more precise and safer. Dr. Thomas Gillette, corneal specialist from TLC Laser Eye Centers, is here now to explain how. How are you?
Thank you, Margaret.
Nice to meet you. I mean, this has been a life-changing technology for a lot of people, like 25 years of this, right? Yes. And so what is different now from when this started?
The lasers that do the correction are much more precise. The devices that we use to measure the eye to determine the amount of correction are much more precise. And there is now available an all-laser procedure which we perform that does not involve a blade, and that makes the procedure more precise.
And that also makes patients more comfortable, I would think. The whole blade idea can be a little daunting.
Yes.
So this all-laser LASIK, how does this work?
So it begins with a complimentary consultation. Your eyes are measured in a variety of ways and scanned to be sure that you don't have a weakness of the cornea that could be exacerbated by the...
And we're seeing some kind of an animation. Can you tell us what's happening here?
Yes, so that is the flap, which is now produced by laser. This is the second laser that changes the shape of the cornea, and then the flap returns to make the eye completely comfortable.
And so what does this feel like when this is happening?
Well, there's a sensation of pressure. There's nothing sharp, nothing hot. Your vision does dim a bit during the first step to create the flap. And then the second step, with the application of the treatment laser, there's no feeling or sensation.
Nothing at all?
Right, correct.
And then does this flap just readhere on its own?
It readheres on its own. There's a layer of cells on the inside of the cornea that create a vacuum, and it readheres the flap for indefinitely.
And then you get up and go home.
That's right, correct.
How about that? Lots of people were not candidates originally, had astigmatisms or other problems. That's a little different now, yes?
Very different. We can create good corrections for people with high amounts of myopia, nearsightedness, and farsightedness, and astigmatism. All three categories are now treatable.
That's interesting. So is this covered by insurance, or is this something people have to pay for on their own?
Generally not covered by insurance. There are some employers that have flex plans that allow for payment for this.
Okay. Well, whenever people are talking about their eyes and procedures on their eyes, they're, you know, obviously that could be a little frightening or make you a bit nervous. What can we tell people now that will make them a bit more comfortable about having this, because they can literally get rid of their glasses, which is a pretty big deal?
I think that the usual concern, the greatest concern, is blindness, loss of vision. Yeah. And that's not the case with modern LASIK surgery, especially with the all-laser procedure that we provide.
Now, you have kind of a unique relationship between a patient's own doctor and the TLC doctor. Tell me how that works.
We do. We have an integrated care system that ensures a relationship with the patient before the consultation, that is through their community eye physician or optometrist. And then we have optometrists who ensure quality within the center, and then patients are returned to their family eye physician afterwards.
Now, you have something called the premium experience for patients?
We feel that our whole experience is premium including all scans that are currently available to identify patients that should not have LASIK.
Which would be what? Who would fall
Well,
into that
there are
category?
patients that have conditions called keratoconus, for instance, or form-fruste keratoconus, where they have changes in the shape of their cornea that has not produced symptoms yet, but would be exacerbated by LASIK.
And we're seeing some more video of the patient experience. I didn't mean to interrupt you with that, but in terms of this premium patient experience, tell me a bit more.
So, when the patient enters the laser area, they've met the surgeon, they've discussed at length during their consultation. We ensure that the patient's comfortable. The laser is in a room that's temperature controlled and humidity controlled, and sometimes is a bit chilly. So they have a blanket to make them feel comfortable. They have a teddy bear to hold during the step with the pressure.
That makes sense. And you have a lifetime commitment to your patients as well. Tell me about this.
We do. So the cost of their procedure includes both pre-op evaluation, the surgery itself, and a lifetime of post-op care, ensuring that the patient is always connected with the care that they need.
That's pretty cool, because if you had any worries about it, you know that you've got backup for as long as you need it.
Correct.
That's terrific. Thank you very much for talking to us about this. TLC Laser Eye Centers offers a thorough, no-obligation consultation to find out whether you're a candidate for LASIK. You can find them at tlcvision.com.